Okay, we are doing blood, and we're going to be doing iron now, okay? Remember, iron is important as one of the elements when we're doing blood because iron denotes how oxygen is attaching to the red blood cells, okay? So without enough iron, hemoglobin, which is in the red blood cells, carries oxygen to all the cells of the body. So you remember you have your red blood cells and they're like bioconcave, like donuts almost. The oxygen fits in. The iron is the heme for hemoglobin. The iron is the heme. It takes 4 iron molecules per red blood cell to carry it, almost like a pitcher with a baseball. You have 4 little spots that oxygen fits into and is carried on the face of the red blood cell, okay? So heme is really important. It also provides information on how the liver and the spleen are functioning. Increases of iron are indicative of some types of anemias, but it's more often that the decreases are anemias. Anemia means lack of oxygen binding for the red blood cell. It means that a lack of oxygen delivery. This is one of the most common problems that we have in our nutritional medicine. Remember, I say that if I have a client and things are not going right, like I'm having difficulty healing them, I'm like, okay, well, let's go back to polarity. All right, well, I did that. Let's go back to switching. Well, I did that. Let's go back to the healing affirmations. Well, I did that. Well, let's go back to battery. Well, I did that. And they're still not getting better? Run a blood test. Look for anemias. Because if the patient is anemic, oxygen heals everything and oxygen feeds everything. If they're lacking oxygen, they're not going to heal. See? So they're going to be a chronic client. So for a while there, when I started developing the healing format, I thought, well, maybe I should put anemia in the healing potential program. Remember, the healing potential is polarity and switching and affirmations and battery, right? So I thought, well, maybe I should put anemia as one of the factors. And I think even in one of my forms, old forms, I have anemia, checking for anemia as one of the healing potential factors, because if they don't have enough oxygen, then they're just going to have a healing potential issue, okay? So important to test for iron, right? Really important. And then the iron is broken down into the actual iron. And iron, if you look at iron this way, the number of iron, when you look at iron and you do a blood test and you go, oh, what is your iron? Well, that is an overall iron. You don't know if that iron has been, if it's organic iron. You don't know if it's leftover iron skillet casts. Like, do they have iron because they're cribbing on an iron skillet, like, is it toxic iron or is it usable iron? Is it iron that's going to get into the cells? Is it iron that binds to hemoglobin? Just because they have iron doesn't mean that they're not anemic. Like, if they are using iron skillets every day, their iron count might be normal. They might be normal. So that's where these other couple tests are good, like the TIBC, total iron binding capacity, and then the UIBC. So each one of these will denote whether that iron is being utilized or not. Further tests on iron, the real accurate test for iron is something called ferritin. Okay, now that's ferrous iron. It's a certain type. It's organic. That means it's bioavailable. It's the iron that would stick to the blood cells. It's the usable iron. And that is the most accurate measure. So if you're considering the person with iron deficient anemia, and even if their iron comes back normal, run a ferritin. Now, ferritin alone is like $35 or $40 just for ferritin, so they don't add it to this lab because it increases your price so much, right? Because you're like 165 for, you guys are like 155 or 165 for your lab. So it'd be like cost your lab $200 now just to add one test, right? So generally speaking, you don't, for most people, need to run